Welcome to the show, Dr. Butler. What a pleasure to have you here.
Thank you very much.
Well, I'd like to start off by finding out how long you've been here. I think you're a newbie, right?
Yes, I've been here 3 weeks now.
Wow, and we've had great weather, so you're probably really happy with
Yes, it's been great.
that. Great. So tell me, what brought you to Brunswick County?
It's a nice area. It's a beautiful area. It's a smaller town atmosphere, which my kids and myself really enjoy, and it was just a great opportunity for us.
Well, wonderful. We're happy you're here too.
Thank you.
You're welcome. Well, let's talk a little bit about your education and your background. Tell me, where did you go to school?
I went to Marshall University in Huntington, West Virginia,
Wow.
and I achieved a bachelor's in chemistry there. And then I got my doctoral degree from the West Virginia School of Osteopathic Medicine. And after graduation, I did my residency at the WVU Charleston Area Medical Center in Charleston, West Virginia.
Wow, you're a proud West Virginian.
Yes.
I can tell. I can tell. And of the herd, right?
Yes, ma'am.
Well, I know that you've joined Seashore Pediatrics with Dr. Ludlow, and he was on our show not long ago, actually. Do you have other partners there at the practice?
Yes, we have Dr. Young and Dr. Sanger and Dr. Richards as well.
Quite a few of you there then.
Yes.
Well, I'm curious, where are you all located?
We have 3 offices. The one I'm mostly at is in Charlotte on 3650 Express Drive. And then we have offices in Loris and Long, South Carolina as well.
Well, being a parent of older children now, of course, but when I had young children, I was always worried about sick visits and worried about waiting to get up in the morning and make that call when the office opened. Tell me how you operate with sick visits. What's your process?
If you're our patient, we try our best to get you in the same day. So if you call that morning, it is our goal to get you in if you have a sick child, because our thought is if you come see us, we should be there to accommodate you when you need us the most.
That's a wonderful philosophy.
Yes.
And when you're on call, do you take your own phone calls?
Yes, we do. We alternate which provider takes phone calls, but we have someone on call 24 hours a day.
So if a viewer out there had a small child, a patient of yours who was sick, and they placed a call to you, it's likely they would get you or one of your partners right on the phone then. Is
Absolutely.
that correct? I think that's very unique, and I think that's, if I were a new parent, that's exactly the kind of practice I would want to be involved with. So I applaud you for that.
Thank you. Thank you.
That's wonderful. And I also think I heard that you guys have different waiting areas for sick children versus well children. Tell me about that.
Yes, we do. We have different waiting rooms. One is a well visit waiting room and the other is a sick visit waiting room. So if you're there with a sick child, or excuse me, if you're there with a routine visit, you're not sitting beside other children who might have the flu or strep or things like that. So your child shouldn't become contaminated with germs.
Yeah, there's nothing worse than bringing your child in for their little checkup and they end up getting sick from their checkup.
Right.
So I think that's wonderful, especially this time of year, which leads me into my next topic of the flu. And since we're kind of in flu season, give us some insight into how you prevent kids from getting the flu. Is there anything you can do?
The biggest thing is prevention, and the biggest thing to prevent it is the flu vaccine. And this year we have 2 types available, the traditional injection form, and then we have an intranasal form too. So instead of getting a shot, kids can come in and it's a mist that's sprayed into their nose. Now there are criteria you must meet before you're able to receive that. You can't have any ongoing asthma or lung conditions with wheezing, and you have to be older than 2 years old. But if you meet those, you can avoid the typical injection that we associate with the flu vaccine.
Yeah, I was wondering what would make that decision, whether you would have the shot, the injection, or the vaccine. Do they both work equally well?
Yes, yes they do. They're both very effective.
Well, that's good to know, especially for those kids who don't like those needles.
Absolutely.
That's great. I wondered what do parents do if they find out their child does have the flu? What would be some of the things they might have to do?
If you suspect your child has the flu, we encourage people to come to the office right away. There is a medicine, which is rare for a viral infection, but there is a medicine for influenza. And if we can confirm it is the flu, we're able to start that. And if we start it within the first 48 hours of symptoms, then it is very effective to cut down the duration of the illness and the severity of it. If you're outside of that 48-hour window, the biggest thing is just take care of your child. Lots of fluids. Warm fluids are very good. They feel better on the chest. And then fever control.
And typically, how long does the flu last?
Typically, it can last a week to 10 days.
Wow.
The worst part of the symptoms are generally the beginning, the first 3 to 5 days. But it can last as long as a week.
Yeah, nothing worse than a sick baby at night and with the fever, and
goodness.
that's a long time. So, well, that's really great information. I'm sure our viewers will find that very interesting. Getting back to you, I was wondering, do you have any special interests or areas of focus that you are particular about?
My favorite is newborns.
Of
I love
course.
newborns through toddlers. And they remind me of my own children.
Of
So
course
I
they do.
enjoy those the most.
Well, Dr. Butler, are you and your partners currently accepting new patients?
Yes, ma'am, we are.
And how might they schedule those appointments? Do you have a phone number?
They can feel free to call us at 910-754-BABY or 2229.
I love that phone number. It's baby is so easy to remember.
Yes, yes.
That's great. Well, Dr. Butler, it's been a pleasure to have you on the show today.
Thank you.
I look forward to seeing you again real soon. We'll have you back, and maybe we'll talk about sunburn in the summer, right?
That sounds great.
Okay, great. Thanks again for joining us.
Thank you for having me.
You're welcome.